Nashville Health brought together nonprofits from across Nashville just to see what could we do together. And so we just presented some research that we already had on hand about the cost of chronic disease in Tennessee. So really putting that in an economic context of what does it cost us as a state that we have higher rates of chronic disease in Tennessee than other states do. So the Sycamore Institute has been at the table since before the project began. I like to joke that we are the professional note takers, but basically we are the process evaluator in the Heart of Nashville project. We are intentional about collecting data on everything that the partners are doing. So when they learn a lesson, we take note of that. That way we can learn from what we're doing, we can keep improving, but also our role is to make it replicable. And I think that the people that are funding it, if what we're doing here is successful, want to be able to take this to other communities so that we can capitalize on all this work that we're doing so that we can improve health among lots of populations and lots of communities. Collective impact is about bringing together disparate resources that are all doing amazing things on their own, but it's about creating a connective tissue between these things. And we're all working in the nonprofit community with very limited resources. So doing things like coordinating, it takes effort, it takes additional resources. So when you bring in an additional partner like NashvilleHealth to be that connective tissue, to make sure that each of these partners in the process have the resources that they need to make sure that all of this stuff works smoothly for the patients. Health is at the center of everything, right? This project is such an acknowledgement of that it goes beyond just those clinic doors. Sure, it's the medical care, we know that, but it's also about being able to eat healthy. It's about being able to access healthy food in your neighborhood, being able to get to those things. And we know that North Nashville is changing very rapidly, and some of those resources are going away, or maybe they're out of reach for the folks that have traditionally lived there. And so I think this project really acknowledges how those things are important, but also those things are shifting in this neighborhood, and trying to meet longtime residents where they are and find the resources that they need to live happy, healthy lives.